Hey everyone, I'm Dr. Mary James with the Women's Health Network. What do you picture when you hear hypothyroidism? Well, most of us picture symptoms like fatigue, weight gain, chilliness, constipation, fuzzy thinking, changes in mood, maybe even changes in hair or skin. Well, there's another symptom of hypothyroidism that people hardly ever associate with the condition, despite the fact that as many as 80% of people suffer from it. I'm talking about chronic muscle or joint pain. As a reminder, hypothyroidism is real common, especially in women, and especially as we age. 1 in 6 of us women will be hypothyroid by age 60. That's a lot, right? So what symptoms are we talking about here? Joint pain, muscle aches or stiffness, muscle weakness, maybe muscle cramping. Well, why would body pain even result from low thyroid function? Well, remember that your thyroid regulates metabolism, including how your body burns fuel for energy. So with low thyroid function, you're going to have slower or defective metabolism, including in your muscles. Fuel simply isn't burned efficiently. With low thyroid function, your carnitine levels can drop. Carnitine is a natural compound in the body that burns fats for energy. You know that uncomfortable feeling of lactic acid build up in your muscles when you've exercised real hard? Well, a low carnitine level makes that pain a whole lot worse. With low thyroid function, you can have muscle weakness. This is mostly going to be due to malfunctioning of the mitochondria in your muscles. Remember that mitochondria is the energy-producing machinery in your cells. That weakness can also be due to insulin resistance. And with that, glucose has trouble getting into the cells to be used for energy. Your thyroid keeps things moving, but it also is responsible for keeping a lot of things in place in the body where they're supposed to be. So with hypothyroidism, fluid can accumulate in your soft tissues and joints, and that can lead to stiffness and discomfort. Calcium can have a harder time getting back into the muscles. What does that do? That can lead to prolonged muscle contraction. Well, the good news in all of this depressing discussion is that your body pain just might be due to something as simple as low thyroid function. So if you're suffering from these symptoms, I really encourage you to go get evaluated by your healthcare practitioner. There are lots of different possible causes of chronic joint or muscle pain, but this is such a common symptom of low thyroid, and hypothyroidism is so common and so easy to diagnose that this simple test should be one of the first things to check through your doctor. And if that is what's going on, and your thyroid gets corrected, you're going to feel better in a whole lot of other ways as well. How would it feel to also have better energy? Or to think more clearly? I hope this has been helpful. I look forward to talking with you next time.